So as always, first step is to get logged into PhysDAP. And then first I actually do want to start on the Appendix G side of things because there is a little bit of setup that needs to be done for those who are trying to make sure their lab skills count, or their lab skills and their lab patients count towards Appendix G where they need to. So first step to that, for those who have not seen our previous webinars on Appendix G, the account page is where you'll head to set up your program minimums and link your lab skills. And then on the account page, head to Program Info, and then from Program Info, in the bottom is the Manage My COAMS Appendix G Program Minimums. So in general for Appendix G, this is where you'll go to set your numbers. As you can see in this program, I have set numbers, although not all of them are either meeting or above COAMS's recommended, so they show up as red here. Now, again, with most things with COA, they allow you to go below their recommended. You'll just need to defend it if they question you on it, so you don't necessarily need to follow these guidelines, but again, just be ready for it to defend your choice here. If you were to leave these blank, as it mentions here, it will automatically use the recommended numbers for COA. So if you like these recommended numbers, you can actually not worry about setting these. But what I wanted to point out specifically on this page is on tables 2 and 4, as those are primarily the sections that are needing set up that use the lab. So on table 2, column 1, and table 4, column 1, you'll see that there is a number of drop-downs for every line item here, and that drop-down matches the drop-down that you guys have for your lab skills. The reason for this is that we allow for customized lab skills, so programs can either change the name of or completely create lab skills that are 100% unique to their program. But with COAMS, and they want these lab skills to count towards this column 1, we needed a way to translate the custom aspect into the more rigid piece of it for COAMS. So what we've done is we've set up where you essentially say what you want to count for each line item. So on table 4, you can see that these first 2 have been set up, but the rest are all saying none at the moment, so that right now a student would not be able to get credit in column 1 of table 4 for joint splinting. So for spinal mobilization, I have supine set up, which it matches the supine. But for the seated patient, you can see right now I have osseous infusion set up, which probably isn't what we want. But in this instance, with how it's set up, if a student were to enter the intraosseous, then as a lab skill, they would actually get credit towards spinal mobilization seated. So if I were going through here and I wanted to correct this, I would click on the drop down, I would find our seated, and I would set that up. Joint splinting, same idea. Come find joint splinting, there we go. So if you are using the default lab skills that we apply when a program is first set up, you will be, for the most part, totally good to go because the names match identically. The only section where that's not going to apply is in the bottom portion here for the BLS skills. The reason for this is prior to this new change from COA, the BLS skills were not something that we defaulted into paramedic programs because the paramedic programs weren't using the BLS skills.